Welcome to Adapt NCLEX, and thank you for deciding to watch this video. We're going to talk about GI, some key concepts in the form of question by IO staff you need to know if you're a nursing student, your LPN, RN, planning to take your NCLEX or your nursing school exams. You want to watch this video and learn some key aspects how to approach GI questions. First question, always you got to know how to approach the question. My best way, I tell people, is really from the back. It's a selected apply. That means you can pick more than one answers, but don't pick all of them. Sometimes all of them only one answer may be right. You pick those that you know you're confident. It's a selected apply, right? Which client situation require follow-up? That means something is wrong. You got to follow up with it. That is all. Something is not right, and you have to follow up with the patient and figure out what is going on with the patient. Either the patient is saying something wrong, or the combination of information does not make sense. So let me show you. A nurse is aware of several clients in the emergency department. There's always a stem of the question. It does not give you anything. She's just aware. Which client situation require follow-up? There's a follow-up. That's the buzzword. Now, look at this situation. Make sure they make sense. Client is what? He has what? It's lethargic, and he has olive-shaped mass. You know what an olive-shaped mass is, right? This is pyloric stenosis. And lethargic, that means dehydrated. Therefore, this is a priority. Lethargy is a neurological problem. I mean, it's so dehydrated that it's affecting the brain. Later on, it can affect your respiratory status. So this is good. A blood thin mucus stool and a sausage-shaped mass. This is interception, right? Interception, sausage-shaped mass interception is basically you having ischemia of the bowel. And the presentation of ischemia is a blood thin mucus stool. This is Karen jelly stool. And that is what you need to do. This is a bad problem. Client has left upper quadrant pain who has a positive rapid mono test. This is mononucleosis. It's kissing disease. When they complain of abdominal pain that means their spleen or liver has ruptured. This patient's spleen probably is bleeding. They should not have contact sports for 14 days. No contact sport for 14 days. This benign question I've said is a priority. I have frank ecchymosis and I have elevated amylase and lipase and I have abdominal pain. This is pancreatitis and you have frank ecchymosis. That's hemorrhage. We should follow up on this patient. I have pain at McBurney's point with the Sunday cessation of the pain. Patient has appendicitis because of the McBurney's point, and the pain all of a sudden went away. That is a rupture. This is also a priority. This is how you answer NCLEX question. And when somebody tell you they have a magic bullet for prioritization, no, they lying to you. You have to focus on the buzzword, connect the dots, and you got to be sharp when you trying to select your answer choice. And you can watch videos on prioritization on my channel. I don't give you that magic bullet. I just tell you, just be sharp. Focus on some few stuff. They may not be there, but as you select the answer, look for the buzzwords. These are all the buzzwords, and it makes sense to you that this is the diagnosis, and this is what you have to do. Okay, question 1, down. A nurse is providing care for a client in the emergency room with worsening end-stage liver disease. Which of the following the nurse should expect to be consistent with the condition? Read it from the back. Select or apply. Pick those you're confident. Consistent with the condition. What is that? Liver disease, end-stage. The liver is responsible for clearing bilirubin from your system. If you have end-stage liver disease, bilirubin is going to be elevated. Liver make proteins and control your INR and then PT level, prothrombin time. Normal prothrombin time is about 11 to like 13 seconds. If you have end-stage liver disease, you can make PT, the clotting factors, so your prothrombin time is going to increase. This has increased to 35 seconds. We have to pick it. The kidney, the liver also is responsible for receiving blood from the spleen everywhere in your GI tract. When the liver is diseased, You develop something we call cirrhosis, portal hypertension. This can lead to the blood not from the spleen not going to the liver. In the process, you develop what we call thrombocytopenia because the spleen destroys all your platelets. The liver make protein. If you have disease process with the liver, you're not going to make protein. So your albumin is going to decrease. The liver is responsible for making protein. And if there's less protein, you develop ascites. So this is skin system. So elevated serum bilirubin, PT time increase, low platelet, and you're going to have decreased albumin and ascites. So those are your question, answer choice. This is GI content, adapting class. Next question. Which of the following the nurse should include in the teaching? That means I have to include in the teaching. A nurse is providing teaching to a client with gastroesophageal reflux, GERD, Bowel, is on Omeprazole, Bowel, for 6 months, Bowel. This is chronic. Connected that. I am on Omeprazole, which is PPI, right? Chronically for 6 months, and I have gastroesophageal reflux for that. Which teaching should I include? What should you worry about when you take Omeprazole, which is PPI? Okay, it causes sedative because of changing the flora in the GI tract. It affects calcium and magnesium absorption. Therefore, you develop osteoporosis. It can cause pneumonia too. Therefore, how do you take this medication? You take it 30 minutes before meal. So you take it after meal. It's a wrong teaching. You can stop taking the medication if your symptom, you have no more symptoms. No, you don't stop it. You continue taking it until your doctor said you don't need it anymore. Increase your vitamin D intake. Because you affect calcium absorption and magnesium, you may not have ability to do that. So supplement your vitamin D is very good. Take the medication every other day. You take it daily, sometimes twice a day, depending on the dose. So 3 is your right answer. This is all GI content in disguise. And then provide care for several clients. Which prescription the nurse should question, select or apply. Once again, go for the buzzword. There's nothing here. Select or apply. Nothing here. Question. Okay. Several clients. Now look at each situation and make sure it's consistent with that. This is what I call buzzword. Say the Clostridium difficile is a viral infection. Is a bacterial infection in your GI tract. It causes diarrhea. What is the treatment? Metronidazole. This is fine. You don't need to question. Clostridium difficile, if you have, sometimes you can give them IV metronidazole or PO vancomycin. You don't need to question it. You have gastric ulcer, you're on chronic what? NSAID, chronic NSAID, probably for osteoarthritis or something, and you cannot come out from that. We know we got to protect your GI tract, right? And then if you don't protect your GI tract, you're likely to bleed more because of the NSAID. What medication will you choose to treat the ulcer? Misoprostol. It protects the mucosa from the NSAID-induced injury. So anybody on NSAIDs, chronic NSAID, they cannot come out of it. Misoprostol is the best way to protect the GI tract. So we don't need to question. Chronic constipation, I give you psyllium. It's a fiber. We don't need to question. You see, there should be only one answer there. Test taking strategy. You got to pick this. If you have gone through all the process and you know what you're doing and you had eliminated 1 and 4, you have to pick 5. I know it's just a lot to apply, but you have one answer. It's designed that way. Expect to see that in your nursing exams anytime. Acute diverticulitis, nobody should get enema. Otherwise, you get perforation. So this is the one we question. Number 5, NS provide care for a client with gastric ulcer prescribed misoprostol. Which statement by the client indicate need for further teaching? Select or apply. Buzzword, misoprostol. How do you take misoprostol? Notify my PCP if my stool is dark, okay? And then very dark, right? Very black and dark. That means what? You're bleeding, right? If you're bleeding, that's a problem. So I should let my PCP know. I will take this medication together with antacid. You should not take it together with the antacid. It causes gastric irritation too. That's why you can bleed from it. You cannot take it with antacid. It worsens the side effect of it. So this is wrong. Cramping and diarrhea is a common side effect. Yeah, this is um, and um, this is it's true. It's an effective way of teaching the patient. They know that chronic diarrhea and then cramping is common side effect. I will stop the medication immediately if found pregnant, right? If I become pregnant, I need to stop taking it. This is abortogenic. It can cause abortion. So this is good. I will take the medication with meal and at bedtime, right? This is also good, right? I will use barrier form of um, birth control while on this medication because it's abortogenic. We don't want you to get pregnant, so you should take a barrier method of oral contraception or effective oral contraception. Therefore, let's go back to the question. These questions can trip you all the time. Further teaching indicated. You always have a video on YouTube. You can watch. It tells you how to approach certain kind of questions. Okay, so this one is said indicated need further teaching. What does that mean? That means they're saying something wrong. If you see very black and dark stool and call your doctor, you don't need to, does not need teaching. I will take this medication together with antacid. You should not take it together with antacid. So you need further teaching. If you know cramping and diarrhea is a common side effect, you don't need teaching. If you stop the medication because you're pregnant, you don't need teaching. If you take the medication with meal and at bedtime, you don't need a teaching. And if you use barrier form of birth control, you don't need teaching. Watch for these trappy answers. So there's only one answer. Number 2 is the right answer. That need further teaching. Number 6, and next provide care for a client with gastroesophageal reflux on long-term therapy of omeprazole who present to the emergency room with tremor, muscle cramps. Which other finding the next should monitor? Select or apply. This is a test-taking strategy to let you review your content. Buzzword, omeprazole, patient has tremor, and muscle cramp for gastroesophageal reflux, right? You know PPI, omeprazole, last name Zol. The causes decreased calcium and magnesium absorption. And patient has tremor and what? Muscle cramp. When calcium and magnesium level are low, especially these symptoms are consistent with magnesium, your symptoms goes up. That is why they have cramps and tremor. Therefore, what other symptoms you should be looking for? Symptoms that are going up. Neuroexcitability, this arrhythmia, yes. Seizure is going up. Hyperrefreshia is going up. Carpal spasm is going up. Anorexia is also going up. These are all side effects of what you should see in this condition. This question requires you to think carefully what is going on. But the buzzword is reflux, omeprazole, and you have tremor, muscle cramp. They tell you they are either have magnesium deficiency or calcium deficiency. 7, a nurse is aware of several clients with severe pancreatitis in the ICU. Which client need immediate follow-up? Select or apply. This is may be tricky to you, but they all have severe pancreatitis. So you have 6 patients who have severe pancreatitis, whose condition need immediate follow-up. The pancreas is behind the stomach, is right in the middle. So you're going to have pain right there, okay, from front to the back. It can affect your lungs, right? It can cause bleeding here. So which of this is consistent and is worrisome? White cells of 13,000 is an expected finding of pancreatitis. I'm not worried about it. Decreasing lung compliance, that means your lung is stiff, is causing ARDS, acute respiratory distress syndrome. That's bad. Therefore, this need a problem. Mid epigastric pain of 6 out of 10. I expect that is the pain I expect. So this kind of question, I call it, you have to be sharp. It's a be sharp moment right there. This is an expected finding. Decreased tidal volume is a lung issue. Your lung tidal volume is how much air you can put in every time you take a single breath. If it's decreased, that means you have athleticism here. This is a problem. Glucose of 200, the pancreas secretes insulin, and therefore, if you have pancreatitis, you have issue with secretion. Your glucose go up a little bit. This is not a priority, it's expected. Frank ecchymosis is a complication. You have bleeding into the retroperitoneum, you get frank ecchymosis. This is Gray Turner syndrome. This is your major problem. In effect, what am I trying to teach you? If you have pancreatitis, every time they give you, priority function should be patient is having lung symptoms or they bleeding. And the bleeding will be Gray Turner sign or Kellen sign. This is Dr. Plus. I hope you're learning something. Number 8, and then provide care for a client who is post-exploratory laparotomy prescribed clear liquid diet. Which diet choice by the client the nurse should intervene, select or apply? Rewrite the question again, figure out what is the problem. They said diet choice, you should intervene. We're talking about clear liquid diet. Therefore, which of these is a clear liquid diet? The one that is not clear liquid diet, you should intervene. Clear liquid diet is anything you can see through. You can see the liquid through, is fine, except coffee. So coffee is a clear liquid diet, even though it's black. The rest you have to see through. So black coffee, gelatin you can see through. PepsiCo you can see through when it melts. Milk is not. Pudding is not. Vegetable juice is not. So 1, 2, 3 are acceptable. The patient make the right choice. Therefore, which ones are the right? You should intervene. This one. So the right answer is 4, 5, and 6. These are the ones you want to intervene. 1, 2, 3 are normal. You don't need to intervene. Number 9, and let's provide care for a client with severe pancreatitis in the ICU. Which finding is the most concerning? This is the same question I asked you, but I make it a single case. One patient with pancreatitis, which is most concerning? I told you pancreatitis, the priority function is what? They have a lung symptoms or they're bleeding. White blood cell count of 14 is bad, but we got to see if there's some lung issue. You have decreased lung compliance, okay? So this is your lung. So they have a lung issue. This is airway, right? They have epigastric pain. They have pain issue. They have frank ecchymosis. They're bleeding. This is what I call B-sharp moment. Which of this is worrisome? So when I say B-sharp, I'm talking about is the patient have the breathing problem? Yeah. Or airway problem? Yeah. Does they have electrolyte issue? No. Do they have shock? Yeah, it's here. Do they have airway issue? Yeah. Do they have pain? Yeah. Do they have sepsis? Yeah. So you have sepsis, you have airway, which is any breathing issue, you have shock, and you have pain. Which one do you think is bad? You got to be second. If you have 1 second, who do you want to see? Decreased lung compliance. They're having airway issue. Number 2 is your right answer. And last one, this should say number 10. And this is assessing a client in emergency, uh, client in the emergency room with a history of respiratory laparotomy 3 years ago who report nausea and bilious emesis for 2 days. Exams reveal high-pitched bowel sounds, abdominal distension, and colicky pain. Which intervention should they anticipate? Just figure out the buzzwords. Patient came in with the history of respiratory laparotomy, so previous surgery. Report nausea and bilious. Something is not right. Bilious means something is coming from where it's out of your mouth that is not supposed to be there. They are not gastric content. They are green. So something is wrong. Exams high pitch sound. That means there's blockage. That's why there's high pitch sound. The abdomen is distended, blockage, and colicky pain, blockage on and off. Which intervention the nation implement? We have small bowel obstruction. We have small bowel obstruction. We need to have NG tube to decompress you. We don't need enema. We need to get an X-ray to see how bad it is. We don't need to feed you right now. We can give you antiemetic to help with the nausea. So 1, 3, and 5 are right answer. This is Adapt NCLEX, and thank you for watching the video. I hope you learned something. Good luck in your exams. You can subscribe if you like this video, share it to your friends who are struggling to pass. They will thank you very much because of the content that they will learn. So share your video, take care of yourself, and if you like this video, you can subscribe to Adapt NCLEX so that you can get more of this. Take care of yourself, and good luck. Best of luck. Bye.